is the definition of autism?
Autism is the one-word form of the actual phrase of the disorder, and we call that autism spectrum disorder, or ASD for short. And this disorder, well, let's start with about normal development. Starting from infancy, we expect social interactions to be developed from this early stage. But autism, or ASD, is a neurological developmental problem that causes a child to behave as if they're in their own world, display odd routines or repetitive routines, odd and strange behaviors, have problem with communication, and have a lack of social awareness or interest in others. This combination, we would suspect that there is autism spectrum disorder. And the word spectrum means a variety of severity. It could be mild form of this disorder or very severe, and we'll talk about that more later.
What are known causes of autism?
You know, the direct main causes are unknown, but there are theories that it could be a problem with the function or structure of the central nervous system. So we do consider it a neurological, neurodevelopmental problem. And we are sure what it is not from. It is not from parents themselves. Okay, they don't cause the ASD. And vaccines do not cause ASD. There were all of these theories trying to explain what it came from, but we know now that we can't blame those two. Genetics directly isn't the entire answer as well, but we do see genetics play a role, because sometimes when we diagnose in children that one or the other parent seems like they might have a mild form too. So yes, sometimes we do see maybe some passing down of some genes.
Can drug abuse or alcoholism be a cause of autism in babies?
By the mother, you mean?
Yes, by the mother.
I see. So the answer is no. I think there are different disorders and problems. For example, alcohol usage during pregnancy can cause something called a fetal alcohol syndrome. And drugs definitely can affect the development of the fetus in the womb and have consequences after birth. But in terms of autism spectrum disorder, that is not a known cause.
Can autism be healed over time?
I would have to report that there's no medical cure for ASD, but development and function, it can be positively impacted with appropriate and specialized treatment earlier. That's important to know, because if it's not helped earlier, if these children aren't given these services or support, then emotional control, relationship building, and disruptive behaviors can worsen. So I would want to say, even though we can't just wipe out the autism in the child, and that really shouldn't be the number one goal, we should help the development beyond the time of diagnosis.
What types of treatment are available?
So like I said, the word spectrum means a variety of severity, right? Mild to moderate to severe, and that's why it's called autism spectrum disorder. So if they have low functioning, many times it's because they have extreme speech issues, to the point where they can't speak at all, or their speech is very limited. Many times they have intellectual disability, and we talked about that before. So the approach would be different for high functioning autism. High functioning autism is where the speech is not an issue. So sometimes it's difficult to diagnose these children. But the struggle with emotional awareness and something what we call reciprocity is very difficult. And the older they become, from younger elementary to older elementary, junior high, high school, it becomes more and more apparent that they're not relating very well with their peers. So a comprehensive evaluation can determine what kind of services are needed, like the specialized language service or behavioral and educational programs, or peer relationship social training programs. Sometimes that's very important. And sometimes we do need medications for this, and that's where my role comes in as a psychiatrist. Autism spectrum disorder sometimes causes difficulty to control extreme emotions, particularly anger and irritability. Uh, and it's not their fault. Like, it looks like they're doing that on purpose and lashing out, or being very loud, or even physically assaultive. And that is caused by the ASD, or autism spectrum disorder. So sometimes we do have to use medications to help calm that piece down. Otherwise, they'll hurt themselves, they'll hurt other people, and then internally, without their ability to express it, they will feel guilt about that too.
So, how is ASD diagnosed exactly?
Very good question. So we do have a set of criteria that we have to study and do extensive interviewing of parents, but many parents can't answer those questions exactly and specifically. For example, when we ask them about their social awareness, their ability to reciprocate emotions, some parents would be like, I don't know, they look fine to me, right? So there are objective testing measures, what we call testing materials, and it is standardized. So a clinical psychologist who is trained and certified in those kind of testings are able to do the entire test from the first hour to the final hour to get the most objective observation and testing for that.
What is Asperger's syndrome? Is that also something similar to autism?
Very good question. Now, the new Diagnostic Statistics Manual lumped autism and Asperger's into one disorder, and that's the autism spectrum disorder. So in the past, if someone was diagnosed with Asperger's syndrome, that was more of a high functioning autism, symptoms of behaviors and rituals or social issues, but without the speech problem.
What can parents or teachers do to help children with this problem?
Yes. So when or if there is an observation that behaviors are different or looking different from other children of the same age, or they're unexpected, definitely we should avoid delaying the possibility of getting an evaluation and diagnosis. So for example, they are withdrawn or looking aloof or fail to respond to others. And that is something you can even detect from 1.5 years old or 2 years old. Like, they really don't look interested in smiling back at you or playing with you. Minimal or no eye contact, or odd and repetitive ritualistic behaviors like rocking a lot, or hand flapping, or something repetitive. And another interesting one is this obsessive need to keep things in order. It is not usual for children to put all of their cars really, really straight and equal spaces in between, or organize everything in their room to be very, very, very tidy and very organized. That is not something very typical, and I would even say not normal for children. They usually don't care and everything's all over the place. So if you notice these things and it's persistent, then I'm not saying automatically the child has ASD. It deserves an evaluation because early intervention is always the best. Um, Next thing I want to encourage parents, especially, is to not feel ashamed. If you did receive, if your child received the diagnosis, don't be ashamed, don't be embarrassed, because if somebody has a medical disorder, they have a medical disorder. But to deny that and to delay treatment is a disservice to the child. It's not the child's fault to have ASD. But it would be the parents' fault to delay bridging those gaps of letting the development to be as best and its greatest potential it could be. Also, to know that a lot of the behaviors, negative behaviors or weird behaviors, it comes from the disorder, ASD. And it's not intentional to make parents' life difficult. That is sometimes one of the most difficult things to remember for parents, and understandably so. And then the next thing is to really cultivate a deep, great level of patience. That is something so hard to encourage parents because you're living with the child who's causing so much struggle every day. But learning specifically how to bond and connect with your child, and they can't connect the typical way, so that's why I'm saying the word learn what would connect with them and using the language that they are understanding. And that's why meeting a professional who understands ASD helps, because it will teach you the mindset or the psychology that's going on within the mind of the child who has ASD. So that one, I really want to encourage that, because they cannot express love back to you. For example, severe ASD, the children might just be might look calm and unresponsive when you say, "I love you, honey," and they might just go like this. And so you can get really hurt, right? How are you? Good. Because their language is different from the language that we know, right? So that's why when we go to a different country, we learn their language and we learn their culture, and we try to connect in the ways that they feel connected. I would say the same thing even with ASD. So there's so much to learn, and it could be something very rewarding to learn and not compare with your other children. For example, the child that knows how to hug you back, then you might feel so loved and you can reciprocate that affection with that child. But the one with the ASD doesn't care for it, doesn't want it, and doesn't give it back to you. That does not mean that they don't want love. They just don't want love in that way, for example.
What words of encouragement do you have for parents with autistic children?
Yes. First of all, is to know that is not due to your past mistakes or pregnancy issues or like some sort of punishment for how you grew up. And also not due to your poor parenting. If the diagnosis occurred around age 5, a lot of parents feel very guilty. It must have been what I've done from infancy to now, and it is not. It's just got discovered at age 5. And although this disorder, a child with this disorder can be classified as a special needs child, to remember that your child is special in God's eyes. A lot of parents have shame that they have a special needs child or a disabled child. But God has a plan for all of us, and has a plan for your child for his or her future. And we parents and teachers, we need to help bridge those gaps, right? During development, ASD has many more gaps, and we can be there to help bridge them and to help teach them to discover their assets, which means their strengths, and to help them feel what they could have control and what they could accomplish. And also, definitely to present the gospel according to their level. Remember, I said about how they have a different culture or language and they don't understand. So maybe the word love is difficult. And we're always saying, Jesus loves you. Maybe that's not something they can understand, because within that love, there's all of these other words that's encompassed within that word. So maybe we need to break it down. What concretely what Jesus loves you means, right? And I don't have time to go through that detail. And lastly, God showed us love before we even knew him, right? The unconditional love of Jesus, who died for us while we were yet sinners. And so I'm not saying we have to accept negative behaviors and not show them consequences, because there's a particular type of therapy that the United States and I think other countries are implementing. It's called ABA, Applied Behavioral Analysis. And this is about consequences for certain behaviors to help them learn that's not going to be beneficial. But unconditional love in general is what I want to encourage our parents and teachers. We can provide direction, consequence, prompting of appropriate behaviors, but yet still show unconditional